Hello, everyone. In this video lecture, I've created a different slide deck for you to look at. There's a lot of information here. I wanted to just focus on the more pertinent parts, but in order to do well this week, you may want to completely review the entire chapters 12, 13, and 14 and review the entire slides. Let's have a look at coding and reimbursement. And again, here are the high points of chapter 12, dealing with coding and reimbursement. We'll talk about different types of coding credentials, coding expertise levels. We'll talk about coding productivity standards. Again, since coding is so closely tied to reimbursement, everybody wants to get the most bang for their buck. So that's where the standards come in. And then we'll talk about coding management responsibilities, and then we'll talk also about clinical documentation integrity tasks. Coding management involves the coding supervisor, the lead, the coding manager, the director, and so on. The organizational structure will vary based on the organization, but basically they do the same types of management functions except directed solely towards coding. This includes organizing the healthcare coding processes, hiring and training staff, ensure that the coders have the proper tools and resources, conduct performance assessments, and provide continuing education. Some common coding credentials we see are the CCA, CCS, CPC, RHAA, and RHIT. These credentials may vary. In general, if you want to work as a remote coder doing a hospital coding, the preferred qualifications are a CCS and either an RHAA or a HIT. In other areas, that may vary a little bit. Some organizations have coding training programs, so they might be willing to take somebody with a CCA or a CPC or what have you. We want to also ensure that coders are in the appropriate roles. Many large facilities distinguish between inpatient and outpatient coding. And again, productivity and accuracy standards vary as not all coding is created equal. It's much easier to do code a simple newborn delivery without complications as opposed to a Medicare patient with multiple medical problems. But there are generally some standards, and these may vary amongst facility. And these could be 14 to 16 inpatient hospitalizations a day, or auditing 8 records a day if you're using some sort of automated process. These, again, will vary. But overall, most facilities insist on an accuracy rate of 95%. With probationary employees, they will typically monitor a new coder until this accuracy rate is met. From time to time, we have to query providers. They may be unclear, and as a result, we have to write clear, appropriate, compliant queries. We never want to lead the query to lead the provider to put down a diagnosis that might be a higher paying MSDRG or reimbursable HCC or what have you. And there are a lot of policies and best practices that are written in the AHIMA journal that you can also take a look at. One of the things, if you're going to be a work at home coder, is the coding dashboard. And this will track both the productivity and the accuracy metrics. Some of these things might be the CC and MCC capture rate, overall accuracy rate, overall productivity rate, and other metrics. And these help maintain compliance and also make sure that we're having the coding unit work at optimal level, both in terms of productivity and accuracy. The CDI program and goals is basically to improve provider documentation. The more precise the provider's documentation is, the more accurate the coding will be. We want to make sure that we're capturing the severity of illness and the mortality risk. And sometimes we'll have nurses or other health professionals interface between the coding unit and the physicians themselves. And this ensures that we're coding accurately with better quality documentation. Some of the documentation practices we want to take a look at include such things as documentation that is clear, complete, consistent, legible, precise, reliable, and timely. And electronic health records have very much enhanced this. In fact, there's some that will prompt providers to be more accurate. Typically, CDI staffing, these people are RNs. Sometimes they're RNs and RHIAs. They have 5 years of healthcare experience, and there's specific CDI credentials, the CDIP, CCSDS, CCDSO, CDEO. And basically, they all kind of get into the same type of thing, which is how can we improve documentation to make it more clear so when the coders are viewing the physician documentation, they have an easier time to code the documentation appropriately. Requires strong critical and communication skills, particularly now that queries are going electronically into a provider's in basket so they can see them and react to them. Really important to have great communication skills. And as you might expect, these are also measured on dashboards. So we'll look at how many are fulfilled, how many queries are answered, all these other different types of things. And that's all I have for you. Please make sure and review the text and the full PowerPoint slides on this important information. We'll see you online.